in here come Monday when open enrollment starts for that 2022 plan year. So at the end of 2022, if we're thinking in the future, there will not be that grace period extension into the next year. Instead, it will be carryover feature. So it will be all services have to be incurred by the end of the year. So by 12/31/2022. And then if there's a balance left in the benefit up to $550 of that balance, the employees can carry it over. So that would be deposited into their 2023 benefit. And I think, and this might not be the same for all of you, but I think this concept that we're going to be talking about here, the carryover feature, should not be too new or surprising for many of you, as I know before the SEBB program really was put into effect in 2020, many of you had your own FSA plans, some with Navia even, or with other administrators, and had that carryover feature. And so for those of you who have had that in the past, this is exactly the same as that same feature you used to have. And so hopefully you'll have a leg up in understanding how that works. So yeah, just wanted to call that out. I think a lot of districts will be happy to have it back. So. Okay, and we're going to scroll past here. So here we're going to dive into a little bit more detail on how that carryover is going to work. So again, employees can carry over up to the maximum, which is currently $550. That is an increase. It used to only be $500. And that, of course, like I said, will be at the end of 2022 into 2023. Now, the good thing to note about this, the SEBB, FSA, and DCAP plans is that carryover will only apply to the medical FSA. There is no carryover on the DCAP or the daycare benefits. And that is actually across the board. Carryover is just not an eligible feature for the DCAP plan. So that's important to keep in mind. We're only talking about the medical FSA here. And then to receive carryover, employees don't really have to take any action. It's not like they have to opt in to say, yes, I want carryover. No, I don't want carryover. It's going to happen automatically as long as they meet certain criteria. So one of those criteria is that they have to either enroll in the new year. So that would be the 2023 plan year. They have to make an active enrollment for that year in the FSA. Or if they don't, that's okay. They might still be eligible for carryover, but there's a minimum in place. So we're talking about $120 is the minimum that they have to have as their balance left in order to carry it over into the new year. You guys are going to notice that $120, that is also the new minimum for enrollment. So if somebody's going to enroll in the 2022 plan year, they have to elect at least $120. They couldn't enroll for just, let's say, $50 for the whole year. It's not eligible. And so because that minimum is already in place, we know that if you've enrolled in the 2023 year, you've already met that minimum. You've enrolled for at least 120. So any carryover balance you have, even if it's lower than 120, will carry over. So yeah, moral of the story, you just have to meet that minimum. And then the last thing is that keeping in mind there is also a maximum. So the maximum is that 550. So if an employee has more than 550 left as their balance in 2022, they will not receive their full balance carried over. They'll want to spend down as much as they possibly can because only 550 is going to be safe to roll over for them next year. Anything above that will be forfeited. Okay. So here, like I said, these dates can get really confusing when we're talking about 2 plan years at the same time. So we did try to put in a nice little table sort of infographic here for you to make it hopefully as clear as possible. And we'll walk through that now in this slide. So again, this is going to replace the current grace period feature and the grace period feature is on the 2021 year. So that's still how we're going to end this plan year, is just as normal. But then 2022 is where the changes come in. So last day to incur services on that 2022 plan year. And when we say incur services, we mean swipe the debit card, we mean have a doctor's appointment, purchase an eligible item, the date that those things take place is what we're referring to as incurring, is that date that takes place. That's going to change. It's going to be 12/31/2022. So they won't have that extension. And then last day to submit reimbursement claims. Now, this is a date, we typically refer to this as the claim submission deadline or the claim runout deadline. The good thing is that that's not going anywhere. That's going to still be as is for the new plan year, even though the grace period's going away. So that claim submission deadline is 90 days. It's March 31st of the following year is how long you have to submit your claim. So if you had a doctor's appointment in December and you didn't actually get the documentation for that visit until, you know, January, February of the next year, you can still submit your reimbursement claim for it because you're within that window that goes through March 31st. Okay, so yeah, so just to take you through these visual aids here really quick, 2021 plan year, again, that's where we're at right now. This plan started January 1st of this year, and it ends at the end of December 2021. The grace period exists on that FSA plan, so employees actually have until March 15th of 2022, so next year, to continue incurring their services. And then they have that claim submission deadline. So they've got through March 31st to submit any claims for those services that took place by March 15th. So it's just a couple more weeks to get your paperwork in, right? And then 2022. So this is where the changes come in. That plan year starts January of 2022. It ends December 31st of 2022. And then this is the big change here, is that because the carryover is happening, there's no longer that grace period. So their last day to incur those services now becomes the same day as the last day of the plan year, 12/31. And then again, last day to submit those claims, they still have 90 days to submit paperwork for any services that they did happen to incur by the end of December. It's just that little extra time to get your paperwork in for reimbursement. And then what's not really shown here, because it doesn't affect, you know, plan dates, is that any balance they have left up to that 550 will then carry over. Okay, well, let's get to the new slide here. So another change that's coming, and again, hopefully there's a lot of you guys out there who are familiar with this new change as well. In addition to the carryover, a limited purpose FSA is being added to the benefit offerings for the SEBB program. It's very common for really any employer who has the carryover feature to have that limited purpose FSA. And it's, or sorry, if you have the carryover feature and you have an HSA plan, which we know that SEBB does, and we know that many of you school districts had HSA plans prior to becoming part of the SEBB program as well. So we always recommend a limited FSA, and that's what's being added. So any employees who enroll in the high deductible health plan, that with the SEBB benefits, that comes along with an HSA automatically. And so that means that HSA disqualifies employees from also contributing to a medical FSA. You can't have both HSA and medical FSA in the same plan year. So what is put in place is that limited purpose FSA. And this is a little extra benefit for folks who are enrolled in the HSA and they need a little extra money for dental and vision expenses only. Those are the folks who can enroll in the limited. It works just the same as a medical FSA, except for the expenses. And we'll get into that in further slides here, but it is truly limited, just like the name says, because it cannot cover medical expenses. It's just for dental, vision, and orthodontia. So yeah, sorry, getting a little ahead there. Let's back it up and talk about why that's important for carryover. So when carryover funds, they carry from 2022 into 2023, they, you know, typically are going to be posted to whatever type of account that person had in the prior year, or what they enrolled in for the new year, if they did enroll in the new year. So those employees who do not enroll in any FSA for the new year, so we're talking 2023 at this point, If they did not enroll in any FSA, we don't really know where to put their carryover dollars. So we need to know, are they enrolled in the HSA for 2023? And we, Navia, will work with the healthcare authority after open enrollment next year, so for 2023, to determine who is in the HSA in that high deductible plan. And those folks, if they do have carryover dollars that are going to carry over, we are going to put those into a limited purpose FSA. So the carryover, really the takeaway here is that carryover will not impact somebody's eligibility to enroll in the HSA in the next year. That's why it's important to have that limited, is to make sure that they still get access to their carryover and it does not impact their HSA dollars. Again, all this really happens on the back end between Navia and HCA after open enrollment closes. So no action needed from the employees. Again, like I said, unlike the standard medical FSA, employees can participate in the limited purpose FSA and the HSA in the same plan year. So it's to help them out. And then, yeah, just a reminder. So things to remind employees of if they are questioning, do I enroll in a limited or do I enroll in a medical FSA? The limited FSA is really intended only for people who are covered by an HSA. If they, and that could be either by themselves, if they're in the SEBB high deductible plan, or their spouse. If they aren't enrolled in any, SEBB insurance, but they're covered by their spouse's health insurance, which happens to have an HSA, those are the two groups of employees who are going to really want to take advantage of the limited FSA for their enrollment. Anyone else, anyone who is not impacted by an HSA benefit at all, whether through them or their spouse, should be enrolling in the medical, the regular old medical FSA that we're used to. And that's because we don't want their expenses to be limited. If they accidentally enroll in a limited FSA and then they go to the doctor, that doctor visit is not covered and they don't have an HSA to cover it. So then they're in a sticky situation. So those are the points I would drive home to employees when they're asking those questions about enrolling, is really the limited is just for folks who are impacted by an HSA. Okay, and then yeah, talking a little bit more in depth about what the limited purpose FSA is and how it operates for any of you who need a refresher or who didn't have one with your prior plan. So extremely similar to the medical FSA. It is a personal expense account. It is administered by Navia. It is loaded to the same Navia debit card. They do not get a special new debit card. It's just right there on the same card they already have for, if they enrolled in the medical FSA or the DCAP in prior years. It is compatible with the HSA, as we just discussed. So you could have an HSA contribution and a limited FSA contribution in the same year. It is pre-tax, and those deductions are taken from your salary or from your paychecks pre-tax. And that's why a lot of you, should be aware that Navia and the HCA have been reaching out to get test payroll files from you and really just talk to you about setting up payroll deductions for this limited purpose FSA. The process should be the same. You just have to make sure that you are coding those who are enrolled in limited appropriately, and separately from those who enrolled in the standard medical FSA. So to bring that point home here, those paycheck deductions is really what you guys will be handling. And then this benefit is available to SEBB benefits eligible employees who are enrolled in the high deductible plan with the HSA. So just like we talked about, really if they're enrolled in the HSA or if they have a spouse with an HSA, in some way they are HSA covered, those are the folks who are going to take advantage of this benefit. Okay, and then timeline. This is pretty straightforward. Again, it's exactly the same as the medical FSA. First, you want to estimate, and this is what they'll be doing during open enrollment that starts on Monday, right? They're going to be estimating how much do they typically spend on these qualified expenses in the year. And then that's how they determine how much to enroll for as their annual amount. Then starting January, that money will be deducted from every one of their paychecks pre-tax. That's of course where you guys come in. You'll take those deductions and send that payroll file off to Navia to let us know what was deducted. And then their funds for the limited FSA are available immediately. the total annual amount they elected, they do have access to it from day one. That is exactly the same as the medical FSA. And it's different from the DCAP. As any of you know with experience to that benefit, the DCAP is not pre-funded right up front. It is a money in, money out. So the limited is the pre-funded kind, just like the medical FSA. And then how do they use it? Starting January 1st, once that enrollment is entered, their payroll deductions are going, then they can either pay with their debit card, the funds will be loaded there, or they can pay out of pocket and submit a reimbursement claim to Navia using their same Navia account that they may already have established from prior open enrollments, same debit card, and they'll be able to view their balance and also use the same methods for claim reimbursement right there through the portal. Nice and simple for them. Nothing different from what they're currently doing with medical FSA and DCAP. Okay, moving on, talking a little more in depth about what expenses are eligible. So like I said before, the limited FSA does not cover medical expenses. So no doctor's visits, no prescriptions, those kinds of things. But it does cover dental and orthodontia as well as vision. So any deductible, copay, co-insurance amounts that are related specifically to dental plans or vision plans, those are going to be eligible. Any fillings, cleanings, crowns, just your routine dental work, definitely going to be eligible, as well as orthodontia. So braces, Invisalign, all of those. And just like medical FSA, that covers your dependents and your spouses as well. So if you have a child who is going through orthodontia right now, you're paying monthly for those braces, this will cover that, just like the medical FSA would. And then vision, most common expenses are going to be, of course, contact lenses, corrective eye surgery like LASIK, and even some over-the-counter stuff like contact lens solution or reading glasses. Those are considered eligible as well. Okay, and then this is really just a plug to call out open enrollment. As I said, it does start Monday, so I'm sure you're all well aware of that and really ramping up. We know a lot of questions come in, and we wanted to make sure that you guys have that understanding of how your employees enroll. Nothing is changing this year. Enrollment will be handled by Navia the same way it was last year. Our preferred method of enrollment, the easiest, best really all around for all parties, mainly the employee, is using online enrollment. It's quick, it's easy. They register on Navia's portal, they put in the amount they want, and they immediately get a confirmation email letting them know that enrollment was successful. So they don't have to worry, they don't have to send off a form and wonder if it's going to be processed. And they also have the ability to make changes. So open enrollment lasts Monday, October 25th through Monday, October 22nd. That is the Monday right before Thanksgiving. So they have just about an entire month. And during that time, if they enroll online, they can make changes. They can update or cancel that enrollment at any time during that window. And again, they'll get a confirmation email letting them know exactly what changes were made. And so they know with certainty that it's correct before open enrollment closes. If you do have some folks who still want to do a paper enrollment form, that's okay. We can still accept them. And that's available on the Navia Benefits website as well. And I'm sorry, I should have mentioned, SEBB does have their own Navia website. It is sebb.naviabenefits.com. So starting Monday, they will be able to download a copy of that form and send it via email or mail, for example, if they want to use the paper form instead. And yeah, just like I said, they can edit or remove their election through the end of the open enrollment period. Okay, and then last screen that I'll leave it on here for just a moment is our contact information. So again, the SEBB plan is managed by myself and Sally, and then we have a team of associates who assist us with those questions as well. You guys as benefit administrators can get a hold of us Monday through Friday, 7 a.m. to 5 p.m. We are headquartered out of Renton. So honestly, we're neighbors with most of you guys. You are you do have a local phone number that gets to our team. And when you do call that number, you just want to let them know you're part of the SEBB program so that you can get in touch with one of us who knows your benefits. And then email is also a great way to get a hold of us, especially this time of year. And that email address is esteam4@naviabenefits.com. Please do keep in mind this contact information is for you guys as benefit administrators. Please don't share it with your employees. They have a dedicated customer service team, which is our Navia customer service information available on our website. Nothing's changed there for them. These lines of communication are specifically for benefit administration questions from you guys. All right, double check that I'm not missing a slide. And we're good. I'll go ahead and stop sharing and we can get into some Q&A.
Awesome, thank you. So let me go ahead and share. All right, so let me get the Q&A pulled up. So let's see, the first question that we have are, I'm assuming healthcare FSA account holders being notified of this grace period for 2021, incurring expenses into 3/15/22. So yes, right. I believe, doesn't Navia send reminders?
Yes, we do
Okay.
send reminders as we get towards the end of the year with those plan year end dates, and all information on their portal throughout this year has said that information as well.
Perfect, thank you. The next question, does the carryover amount from 2022 count toward the maximum amount allowed for the 2023 plan year?
Oh, that's a great question. I should have addressed that. Thank you for asking it. The carryover, the beautiful thing about the carryover is it gets tacked right on top of the maximum. So it is not impacted. The employee can still enroll in up to the maximum, which for the medical FSA is still $2,750. $2,750. And any carryover they have will be tacked right on top of that.
Awesome. Can employees have an HRA and HSA accounts?
Oh, okay, yeah. Some groups do have an HRA, whether with another vendor or with Navia. Those benefits are not covered by the SEBB programs, not part of that like suite of benefits, in case anyone was wondering what that is. And that will depend on what the HRA covers. All HRAs are very different. They're very driven by the employer and can be unique. So if it does cover medical expenses, all the same as what a medical FSA would cover, then they could not use that and an HSA. So you'd want to work with your HRA administrator or your HSA administrator to determine, what sort of eligibility you have there.
Perfect. Next question. So what happens if the employee did not contact us to ask questions prior to enrolling online in the wrong FSA? As the employer, we will not know until we receive the 2022 file upload to know if they enrolled in the correct FSA. Will those employees have the option to correct it, especially if they are enrolled in the HSA and enrolling in the wrong FSA?
Yes, absolutely. And we are going to we have a process in place on the back end after open enrollment closes and prior to us sending you guys those file uploads you're talking about to start your payroll deductions. There's a series of auditing that Navia and HCA do together. And part of the audit every year is always to see who has a balance left in their medical FSA and is enrolling in the HSA in the new year, because that has historically always impacted their ability to use the grace period anyway. So part of that this year, we are going to be keeping an eye on who enrolled in the HSA for 2022 and then also accidentally enrolled in the medical FSA for 2022 because they can't do both. And those folks will get a special reach out. There is already a process in place from the healthcare authority to reach out to say, was your intention to make this enrollment? Did you want the limited? We can put you in the limited before the plan gets started. So yeah, there will be a lot of back and forth there to catch as many of those mistakes as possible.
Awesome.
Yeah.
So the limited FSA won't cover prescriptions provided by a dentist.
Oh, that's a good one. Yeah, it will cover dental prescriptions. That might be, it might be a little bit tricky. The debit card might not recognize it because the debit card is just going to see pharmacy. It's not going to know that that was for a dental procedure. So for that, the employee will most likely have to submit further detailed documentation showing that this prescription is specifically for a dental procedure.
Okay. Next question. Which email does an employee use when registering on Navia? Really, that's just the email of their choice, I believe.
That's exactly right. Yeah, for most SEB employees, they don't come their, let's see, their account when it's created on our side does not come with an email address. So when they're registering, they are asked to put in whichever one they'd like to receive communication to, and that gets captured onto their profile when they put it in. So, and they can always change it too. So if somebody is already registered and they want to change their address, their email address, let's say they want it to go to their work address, not their personal address, they can make that update on their own profile at any time.
All right. Next question. Can you please tell me the best way to get the enrollment forms processed? I have been faxing them, but Navia never seems to receive them. I have to fax them up to 4 times before they get processed. We don't email anything with social security numbers or bank account information. So in order to email it, I have to black out that information. I understand
Okay.
online is the best way, but some people want the paper option. And outside of OE, we have to use the paper forms anyways.
That's true. That's true. Yeah. So I definitely apologize there for any the fax issues you're having. If you haven't already, feel free to reach out to our team, to help troubleshoot that. Quite honestly, I think just in the year we're living in now with the technology the way that it is, faxes we've come to realize have just been so much harder to track. And so if it says it went through on your end, but it's just not showing up on our end, that's really where the trail goes cold, versus email where we have, we actually have dates and timestamps. We can track those things down, filters, that sort of thing, and we have a much higher success rate. So I would recommend that blacking out the socials, because the reality is that we're getting eligibility information for all. We have every single SEB eligible employee in our database as of today, the most current information. And that is to make sure that they can enroll online, who we recognize no matter who they are. So really the only instances where we'd absolutely need their social, would be somebody who's brand new, we've never seen them before, and we haven't gotten their information yet. So I would say send it without the social via email. And that way you'll have that confirmation that we did get it and that it is processed. And we then have your contact information via that email to reach out if it does happen to be one of those instances where we need the social, and we can pick up the phone and get a hold of you, or work via a secure fashion to get that info.
Awesome.
Yeah.
Next question. At the end of 2022, do unused limited FSA funds carry over to 2023?
Yep. Yes, they do. Any medical FSA and limited FSA both will have that carryover.
Perfect. When processing ortho claims, do you look at the date of service or the date ortho service is paid?
Oh, yeah, good question. This one for ortho specifically, that is an outlier. Most everything else, it is going to be the date that the service happened. That's going to be the date that is important. But with ortho, they consider the date of payment to be the date of service, because we know that it's usually like a 2-year contract and you're making a monthly payment. So that monthly payment would be considered your service date for that claim.
Okay.
Yeah.
And I'll just verbally say this. Thank you for Michelle for pointing this out. So just a note to other BAs in regards to the email address question, I recommend that they use a personal, or they will get locked out of their reset option when they change employers, as most employers turn off email when the employee terminates. So that's a good point there.
Very good point. Yes.
When is the carryover amount posted to 2023, January or March after the run out is over?
Oh yeah, so that will be posted at the end of January. It does take our system about a month to get everything processed correctly. And then we have the ability to roll it over, to carry it over prior to that deadline, that March deadline. And it's to give people the opportunity to start spending as quickly as possible. We don't, historically, we've had to wait. If those of you, those districts who have had Navia with carryover in the past, you may remember your employees had to wait until after the March 31st deadline to get their carryover. We've since upgraded, and now they can access those funds at the end of January. And our system is smart enough that if somebody does, let's say in February, they're still within that deadline, they do submit a claim for the prior year, that our system will pull money back. It will pull it out of that carryover that went into the new plan year, and it will pay out the claim. So it will reduce their carryover amount after the fact.
Is there a list of allowed expenses available on the website for employees?
There is, yeah, absolutely. At seb.naviabenefits.com, there is an eligible expense list that you can, it's very interactive. You can filter it between benefits and between covered versus not covered.
All right. So there's a question, how are they linked to the SEBB benefits? Kelsey, I'm not exactly sure. If you want to type in maybe some more clarification on what you mean by that. The personal email accounts.
I think maybe she's going back to Michelle's point. They're linked to the Navia registration. So if somebody registers on Navia's portal with their work email address and then they forget their password, to do a reset password, we're going to need to ping that work email address. But if they have since left that agency and they're locked out of that email address, then they won't be able to get into their Navia account because that reset password email just went to a locked account.
Okay, and she did say if they sign up using personal email accounts, how is it linked to SEBB?
Oh, well, their profile in Navia's system is linked to SEBB. We know that they're a SEBB employee, and them adding an email is just telling us how do they want to be communicated with. It does not impact which employer they're connected to. We already know they're connected to SEBB.
Okay, and to answer your other question, Kelsey, they do not need to use the same email that they use on their SAW or the SEBMY account. So it could be whatever email of their choice when they're signing up for an account on Navia. What are the names of the account managers at Navia?
Yeah, so that's myself, Chelsea, and then we have Sally on here as well.
Is the decap limit back to 5,000 for 2022?
It is, yes. That increase to the 10,500 was just temporary for plans ending 2020 and 2021.
Okay, and then what happens if an employee has funds left in the healthcare FSA at the end of the 2021 year and the employee enrolls in a HSA limited purpose FSA for the 2022 plan year?
Yes, so that is part of those checks we're going to be doing, those audits at the end of open enrollment. We would then put that person's carryover into their limited FSA. Even though it started out in a medical FSA the year before, that's okay. They can go between the benefits when we're just talking about carryover. So we would put it into the right benefit for them.
All right. Are there any important updates we need to know for decap?
No important updates other than thank you to the person who asked that question about the maximum. So yeah, just the maximum going back to 5,000. And then the fact that it will not have, for 2022, there will be no grace period or carryover on the decap, which is how that benefit was set up prior to COVID. So it's really just reverting back to how it operated in a normal year. No grace period or carryover.
Okay, and isn't the carryover not available until 2023 and not 2022?
Yes, that's correct.
Okay. I want to make sure I understand the 2021 FSA. So I
Uh-huh.
have one and I have about $800 left. I
Okay.
can continue to schedule doctor, dentist, vision appointments through March 15th, and I can use my 2021 FSA to pay for it.
Correct.
And then Nancy pointed out made a good point that remember anything in district email is subject to public records requests. So it's better that employees use their personal emails for SEBB and related sites. That is very true.
Mm-hmm.
That's all the questions. If you have any last questions or anything like that, feel free to send them in so we can verbally answer them. We'll give it just a few more seconds. You need to check out the FSA store. I'm not exactly sure what you mean by that, Joanne.
What was that again?
You need to check out the FSA store.
Oh, maybe that was just a shout out. We do partner with a website called FSA Store, and there's a link to it right in that eligible expenses page on the website, on our website as well. And it's like online shopping at a Walgreens. You can, any type of expenses that you could get at not a convenience store, a drugstore would be available. And then there's a big check mark that tells you, is this FSA eligible or not? So it's really nice for end of the year when you're scrambling to spend down your balance, or you just want to kind of see what you could use your money on if you happen to have some left over. It's a really great resource to just easy get that done.
Perfect. If an employee has a 2021 medical FSA and enrolls in the high deductible plan for 2022, they must spend their funds by 12/31/21 rather than 3/15/22, correct? What if,
yes.
Okay, and then what if they enroll in the 2022 limited FSA? Can they then use the 2021 balance for dental and vision through 3/15?
No. So that's a good question. So to clarify that, they're absolutely right that because of that grace period has always had an impact on that HSA eligibility. That's why we're doing audits every year already. You have to, if you're in a medical FSA and you're enrolling in the HSA or the high deductible plan with that HSA for 2022, you do not get that grace period extension. You have to spend down your FSA balance by 12/31/2021. Otherwise, you have to wait. You don't get your HSA contributions until after the claim run out period. So about April, you'd have to wait to get your HSA funds. And that's basically to make sure that you can't double dip during those 3 months in both medical FSA and HSA. To your point about, well, if they then enroll in a limited FSA, they can enroll in a limited FSA, totally fine, but they still have that 2021 plan that's totally separate, and they are still beholden to that grace period. So just enrolling in a 2022 limited does not change that fact for them.
Okay. Does the carryover count towards the maximum allowed to contribute for 2023?
Oh yeah, and this one I think we covered earlier, but it does not. It adds right on to the maximum on top of it.
Okay. Will employees that increase their DCAP to 10,500, will they be notified to use funds by December 31st?
Yes, we always send a year-end email regardless, just letting people know to use their funds by the end of the plan.
Perfect. Will the slides be available afterwards or sent via email? Yes. So Chelsea, if you wouldn't mind sending a copy of your slides over to me so then I can send them out to all of the participants for today.
Absolutely.
Be awesome. So I'll send that email out it'll be sometime today, as soon as I get it. I have an employee on unpaid leave for October and is participating in FSA and DCAP. No check means no deduction. Is it okay that I double deduct in November? Do I need to let Navia know ahead of time?
It is okay that you double deduct in November. That's to be expected, and you don't need to let us know ahead of time. You may get what we send as an email saying, "Hey, we didn't get a deduction for this person for October," and you can just let us know. Well, they're on an unpaid leave. They're still eligible. I'm going to double deduct. We don't necessarily have to do anything with that information. We're just letting you know in case there was a payroll error, we can help you correct it. But yeah, if you just take the double deduction and report it to us on your payroll file, you'll be good.
Okay. 2021 DCAP funds are extended. If you enrolled in a DCAP for 2021 and have funds remaining, you can keep incurring expenses and submitting claims through December 31st of 2022. Any leftover funds are not forfeited on December 31st of 2021.
Yes, exactly. And that's a COVID provision. So that's something I didn't want to get too into that honestly in this presentation because we're specifically talking about changes for FSA. I didn't want to muddy the waters too much, but you guys are absolutely right with the DCAP benefit due to specifically a temporary COVID change. That DCAP eligibility date was extended for a year. So there's a year-long grace period to spend down those DCAP funds.
Okay.
And if anyone else has more questions on that, we can definitely answer them, if you want to reach out to us separately.
Perfect.
Yeah.
Is the limited FSA going to be available every year moving forward?
Yes, it is.
All right. That is, one other question. I have an employee who went on leave for the remainder of the year. She has both DCAP and FSA. My school district does not allow payments for FSA or DCAP during leave, and she won't be able to finish paying through us. Should she contact Navia to work out payment of what she needs to pay? She has already spent the FSA amounts.
So I would advise honestly looking at the employer guides. We have guides on the seb.naviabenefits.com website that do walk through FSA and DCAP benefits, and there's a section in there about LOA. The employee could pay post-tax, but like you're saying, your district doesn't allow that. So there isn't an option for her to come directly to Navia to pay that. But you guys could do pre-tax deductions when she comes back next year. You just have to let us know. Or really that kind of falls into the use it or lose it aspect of the benefit that if she doesn't return from leave or she returns too far after and you're not able to take deductions, then her plan just gets closed out at the end of the year. So that's just kind of pretty situational. So that's why I would recommend reading the guides and also contacting Navia, directly if you have more specific questions on that account.
Perfect. Yeah, she said she will be back on 9/1 of 2022. Okay. Any other questions? Now's your chance to send them in. We'll give it a few seconds to see if we get any last questions. SEBB has C1 and C2 leave worksheets that are required to give to employees on leave, and it has options for benefits. That's true, yes. Any other questions?
Sarah, just really quick for you for sending these slides. I'm not sure that I have your email address.
Oh yeah, I can. Let's see. Give me just a second. I'm gonna
Okay,
stop
no problem.
sharing here. All right, and with that being said, there's no other questions coming up. So we'll go ahead and conclude today's presentation. Thank you so much for participating and watching on this Friday. And like I said, once I get the slides, I will send them out to everyone who is registered for the webinar today. So you should be on the lookout for that email from me. And I hope you have a great day and a great weekend.
Thank you so much. Have a great weekend.
Okay, and then Chelsea, I can give you my email. It's Sarah, SARAH story, STORY, at